Right here.
Okay.
Dr. Eneli, that was great, very comprehensive. I thought I heard you say that family-based therapy versus individual, inconsistent. I thought Len Epstein did show that was important, that it should be family-based for effectiveness. Can you comment about that?
Yeah, absolutely. That's a great question. So remember, I think that family-based therapy is important, and that's the way it should go. But that's my clinician hat on. When you actually look at the results from the meta-analysis, it's not clear. The results are mixed. So what I'm doing with this in the presentation is really presenting what the evidence is. The other question to that is what's called the halo effect. If I treat a child, does that affect the parent and make the parent better, right? Again, there's been a lot of work done by Denise Wilfrey and Len Epstein suggesting that effect exists. But we're talking about individual studies. When we look at bariatric surgery, we don't see a consistency for that halo effect. So that's one of the reasons I didn't highlight that.
Thank you.
Yeah.
Thank you, Eneli, for a really wonderful talk. I want to revisit the whole issue of what constitutes success. And you did a good job, I think, trying to define that in terms of Z-scores. But the problem with Z-scores is that the upper reaches of Z-scores, a change in 0.1 or 0.2 is a massive weight change that, and in contrast to your example, doesn't get kids back into the normal range. The other challenge, I think, is that one of the analyses that we probably need to do is to stratify outcomes by percent in excess of the 95th percentile, which I think is equally applicable across groups. But the bottom line is how do we, that change that you showed at the 95th percentile will only reduce the weight of somebody of a child with real severe obesity, maybe down to 120% of the 95th, but not to the normal weight. The other problem is that the duration of follow-up is pretty limited in all those studies. And I worry about the recurrence of some of these risk factors when a child's weight is still in excess of the 95th.
Thank you, Bill. So you've raised things that I struggled with as I looked at the literature. I think that for pediatrics, a lot of that doesn't exist right now. Looking at stratifying the severity of obesity and looking at how the outcomes, what the outcomes will be, would probably be, I think that most of the newer studies should probably look at these interventions that way. I will say that I looked specifically for meta-analysis looking at just kids who were overweight, right? So severe obesity or just overweight. And unfortunately, they all tend to be pulled together. There were about 5 or 6 studies that focused on overweight kids, and the results were similar to the larger group. For the children with severe obesity, it's always a challenge, right? And I think the bigger challenge goes back to that mismatch between the intervention, right, and what we're doing. By the time a child is at the 120th, what are we really expecting, and trying to figure those pieces out. So those were really good points, and I'm not sure that I have answers or the literature has answers, but great area for further funding.
Great.
2 minutes.
Please identify yourself, and I think we have time for 2 quick questions.
Ted Kyle from Pittsburgh and the Roundtable. I was really daunted by your slide, and wonderful talk with 18.5 million children with excess weight and obesity, most of them not receiving evidence-based care. I've seen figures of 2 to 4 million children with severe obesity, and I wonder if you have any figures on how many of them are actually getting the kind of stage 3, stage 4 care that they need, and does that represent a majority of those children not getting care?
Yeah. I know there's going to be a panel on severe obesity, and I actually have a very similar slide looking at the kids with severe obesity. So we have about 5 million kids with severe obesity. And Ted, the number of kids of the 5 million that actually get surgery is 1,200 per year. So again, we're left with 5 million that have lifestyle modification interventions that don't really help. I think that it's definitely an area where collectively in the pediatric world we have to focus on. But I think there's a lot of work to be done there. There are no good answers, right? That's why we're always envious of our adult population. It'll be nice to look at drugs. It will be nice to look at a combination of drugs, lifestyle, and it will be nice to increase access to bariatric surgery. Yes.
Last question.
Thank you. Excellent presentation. I'm Türkan Gardiner from Pragmatica Corporation. I was very interested in the meta-analyses. I'm wondering, could you tell us a little bit more how far back in time period were the studies done? And a little bit about the geographical distribution in the studies that were conducted. Thank you.
Thank you. So I don't have an exact year, but they did a PubMed analysis, a PubMed review. So some of these studies that eventually made it are 20, 30 years old. In terms of the geographic distribution, a number of the studies were, 50% of the studies that were included were done in the United States. So they had studies that were done in Australia and Europe. So this wasn't limited only to studies in the United States. Thank you.